Hi, I'm Dr. Malhar from JOSHI'S Veterinary Clinic. I am owner and founder of this clinic. We work in Malhar. Today, in this podcast, we have Mr. Tanmay Juvekar, who owns Good Doggy, the grooming brand, and he's well known for his grooming expertise. Hi, Tanmay.
Hi Malhar, thank you for that lovely introduction, and I would like to add on to that we completed 8 years in the business.
Congratulations.
So this comes together quite well with having this podcast with a vet. So yes. So picking up from the nutrition, when it comes to skin, what are the most common skin infections or something that you have noticed? Like say we are now in Bombay. So what is the most common that you've seen in Bombay?
See, most commonly anywhere in our country, not just Mumbai, we'll find, let's say, fungal infection, we'll say bacterial infection. But these are not primary infections. Many 80% of the cases, or most of the cases, the infection occurs secondary to something. That's where as a veterinarian, our major role starts playing in to identify the primary problem. Because let's say that this dog comes to me with an fungal infection, I prescribe him 3 medicines, out of which one is omega, one is antifungal, etc. And this dog goes home. After a month, this dog is healed, and after a couple of months, it comes back to the same infection. Now, I'm repeatedly treating the same thing. So I'm just treating the symptoms. I'm not treating the main cause, the primary cause of the disease. Let's say this dog has atopic dermatitis, which is underlying beneath the skin. Now, atopic dermatitis is a genetic disease. We cannot completely cure it. We can control it. We can manage it. So if I'm not treating that with any of the anti-atopic medicines, then I'm not doing any treatment for this dog. So I would say that infections, yes, we see it on daily basis, but underlying causes are totally different. Some are atopic, some are allergic, some are nutritional, some are seasonal, some are genetic predispositions, some are, let's say, contact-based allergies, like someone is using, let's say, XYZ sort of antiseptic in their walk, and the dog rolls on the floor, and because of the contact, now it is happening. Now, unless and until they actually go and check what is the content of that antiseptic and change it to a pet friendly, dog is not going to improvise. How do you feel that, continuing to this conversation, how do you feel that while grooming, you notice something and you stop the grooming over there and you go to a vet at first and then come back to me?
So, like generally what happens is there are no, like in this 8 years, I have never had the chance to stop a groom.
Okay.
It's because generally when people call us up, we talk to them, they tell us that he's itching or he's red or he has dandruff or something. So that is when we actually tell them on call itself, like, okay, first you go to the vet, then you come to us. It's because if they are new to us, if it is not a known client, what happens is that dog is completely a new chapter for me. And to call him over and then start the process and then send him, that's going to be hectic for the dog as well as the client. Because immediately going to a vet and getting an appointment and then coming back to me getting an appointment is not going to happen.
Okay.
But for the regular dogs, what happens is we know the dog and we know how well it had been kept. So when we see something, what we do is we complete the groom and we take photos and we tell it to the client like, okay, this is what I've seen around his crotch or his inner thigh. This is what I've seen in his armpit. There's a red scarring. It is flaky or whatever, it's yellowish red. So we know what it is, but at that moment we don't say what it is. It's because if we say, most probably the client is going to ask me, to abhi kya lagao? And we are, even though I know what has to be done or what medication has to be given,
on your part.
It's wrong on my part to prescribe. So that is when we ask them to go to a vet. But once the grooming is completed, but there have been times where, I have just done the haircut and I've sent them is because you need the skin sample. When
Yeah.
a dog is thoroughly washed, what happens is for that bacteria to grow again, it takes a couple of days.
Yeah, I understand.
And then once it's grown back, now for me, what happens is when I see a skin infection and there's no prescribed shampoo or something, I use betadine
Okay.
scrub to bathe the dog because that is antifungal, antibacterial. It's going to take care of the issue at that moment. It's like an SOS for that moment. Now what happens once I do that, the skin is going to look nice for a week. Now once that is rinsed, the vet can't do the skin sample.
Yeah.
So
For us, then it would be a negative sample, but
Yes.
actually the patient is positive or something.
Yes.
It's a
So
false
that is
negative.
when we do is just do the haircut, send them no bath on that day, get the skin
Okay.
sampling done, get the test done, and then come back to us whatever the vet has prescribed.
So can overbathing, either from your end or from the client's end, whatever it may be, can harm the pet
Overbathing, I mean,
multiple times a week?
multiple times, yes. So generally, like as we previously spoke, there are body oils. Now,
Yeah.
as you and I, we both know, the dogs or cats, they don't have pores on their skin.
Yes.
They have it only on their paws from where they sweat.
Yeah.
Okay. Now, but the pores that are there here, they secrete oil, but they don't
Yeah.
secrete sweat.
Yeah.
Now, this oil layer that is there, it's protecting them.
Hmm.
It's protecting them for number of bacteria that is growing. Now, when you keep rinsing this over and over again, your membrane has spoiled.
Yeah.
Now, I think you would be the better person to know that, like how overbathing spoils the skin.
Yeah.
That also comes down to what type of shampoos you all are using. If you're using something harsh or some mediocre shampoo.
Hmm.
So now that pH level also comes into matter.
Exactly.
In my field, like कौन सा pH level use करना है. Now puppy shampoo pH level would be different than an adult dog shampoo.
Yeah.
Okay, so now those factors, they all culminate into how many times you bathe. If you're using a really nice shampoo which has lots of oils and everything, even if you bathe them once a week, it's okay. But if you're using something harsh like a white shampoo because you have a white dog, now any white shampoo is going to have an X amount of bleaching in it, which is going to cut down the yellow tones which your dog has carried. Now that shampoo, when you use on a regular basis without conditioner, what happens is it's going to rip off all the oils. Your dog's hair is going to get dry. So overbathing is unnecessary. You can use dry baths. You can just do a sponge
Pet
bath
wipe.
for your dog.
Yeah.
You
Pet
have
wipes are also
pet
good.
wipes are also good. Other home remedy, if it is there, then you can do like an apple cider vinegar. It's,
Okay.
you can use boiled neem
Water,
leaves, and you can pour that water. All these are antiseptic methods
Right.
where you're not rinsing out the oil.
Would you like to comment any content of a product which would be a red flag for a dog? Like this, if the shampoo contains this, you should avoid or use it minimally on the dog.
I mean, it's not a red flag, but there are certain shampoos that trigger seizures in dogs,
Okay.
and these are medicated shampoos.
These are antifungal, antibacterial type.
They are tick shampoos.
Okay.
So what happens is just because that active agent of a pesticide is there in it,
Okay, yeah.
for dogs it creates seizures. Now,
Agreed, yeah.
so when a person is using these shampoos, the person has to have a complete knowledge of how much to use
Yeah.
based on the size,
Dog
weight.
should not be licking or consuming that shampoo during the bath.
Yes. Also the weight, size, the health of the dog. If it had a fever, its immune system is compromised right now.
Yes.
If it's on a tick fever medication and it's in the process of getting healed from a tick fever, you can't use these shampoos.
Okay.
Because these shampoos are going to puncture into the skin, get mixed with the bloodstream, and then cause these seizures.
Okay.
So rather than, there are all the shampoos basically are tested and they do not have a red flag as such, unless, you have a very...
But there can be that one wrong day, that one bad day when one dog
Actually,
gets
it
a
is
problem.
not that, it is actually choosing the wrong shampoo for your breed.
Okay.
If you have a fancy breed like poodle, you would not use a shampoo which cost you 120 rupees a bottle.
Okay.
The breed wise, because that breed's need is something else. The texture, the skin health of that breed is something else. The skin is rather more thinner all your Shih Tzus, Lhasas, Yorkie, for
Yeah.
that matter, their skins are thin. The layer is thin now. So you use a particular shampoo that is, help to clean it, as well as it's not going to deteriorate the skin further. So you don't invest in cheaper shampoos. So the red flag actually depends on what you choose
Yeah.
and how you use it.